It is important for women to realize that across their lifespan that they are vulnerable to heart disease. And so heart disease prevention begins in early adulthood. In fact, you could even say it should start in the teenage years, because when you look at the process of the buildup of plaque that leads to heart disease, it silently begins in our late teenage years, in our 20s, in our 30s, and manifests itself as symptoms or a heart attack much later in life.
2 weeks prior to me having a heart attack, I was having symptoms in my back. Little did I know that they were related to my heart attack. And it came about for 2 weeks, and it would go away. So again, I didn't think anything of that. When I actually had the heart attack, I woke up in the middle of the night and my arm dropped, and I felt as though there was an elephant on my chest, and I felt as though I couldn't breathe. So I dialed 911, I called the ambulance, and I took an aspirin as well, because that will slow down any damages. I knew it was something wrong with my heart. I didn't know what it was, but I know that I needed to save it. And as they were providing me with medications and getting all the equipment together and everything, they told me that I needed to be calm because I was in the middle of having a massive heart attack.
When we think of disparities that women encounter in the medical community, very often women can show up with a heart attack or with some sort of acute heart symptom, and you have a delay in recognition and diagnosis because sometimes the ER staff, they're not aware of the spectrum of all of the different symptoms that women can have when presenting with a heart attack.
I went to the emergency room several times because I was experiencing shortness of breath, this very intense pain. I really couldn't identify it. I didn't know what was happening to me. I felt a sensation in my jaw. It would come and go, and I ignored it at first, but it got progressively worse over time. When I went to the emergency room, I was basically sent home. I was given medication to lower my blood pressure because my blood pressure was unusually high. They told me about stress and anxiety, heartburn, and then they would send me home. Now I had a history of going to the ER maybe 5 or 6 times, and then the last thing that they told me was I need to seek mental counseling, as if the pain was all in my head. So I felt like I didn't want to go back to the doctors. I didn't want to go back to the hospital again.
The key, I would say, to eliminating the disparity problem always starts with knowledge and awareness. So women have to become aware that this disease, cardiovascular disease, can affect them. Once a woman is aware of that, then the next step is to find a physician who the woman can relate to, who she has faith in. So a good physician who will listen to what a woman has to say, and the woman has to not accept an answer for a problem, okay, that is anything less than ideal. So I'll give you an example. A woman presents to a doctor, says, "Doctor, I don't feel right. I have this discomfort that's just unusual for me." You can't accept, oh, you know, plenty of women your age have certain stress issues, and it's probably a stress issue. You need to go further. You need to be able to say to the doctor, yes, but women do get heart disease, and I'm worried about that. If the doctor doesn't listen to you, I mean, I hate to say this, but then you need to find another doctor. You need to find a doctor who will actually listen and respond and take you seriously.
We also see a disparity or a difference in risk factors for heart disease among Caucasian women, African American, and Latinas. For example, hypertension. In the African American female community, hypertension is very, very prevalent compared to Caucasian women, lower degree of hypertension. Among Latinas, we see a high incidence of diabetes, much more prevalent, and we know that diabetes is a potent risk factor for heart disease in women. We also see lower levels of exercise or activity in African American and Latinas, and we also see a higher level of obesity and morbid obesity among African American women and Latinas.
So there are both modifiable and non-modifiable risk factors for cardiovascular disease. And modifiable risk factors, obviously, are those that we can modify or change and improve upon, and non-modifiable ones are those that we can do nothing about. And for men and women, the non-modifiable risk factors are gender, genetics, and age, so we can't touch those. We can modify risks such as hypertension, diabetes, hyperlipidemia, and then there are some other modifiable risk factors that we often don't touch, such as stress.
I enjoy walks more, and I enjoy the sunshine more. To be honest with you, I've never enjoyed the sunshine as much. I even bought a convertible so that on each sunny day I ride with the top down. And those little things help me to de-stress and to get back myself.
I became an advocate because I wanted women to know that we matter. First and foremost, when I had my heart attack at 42 years old, I didn't know any of the risk factors. I didn't know any of the family history of my heart disease, and I just didn't have a lot of information about heart health because I was one of the women in America that thought that heart disease was an old white man's disease. It didn't affect me at all. But after I had my heart attack, and I started doing research and studying because I wanted to know kind of why. And once I found out that heart disease was the #1 killer for women in America, I was like, wow, really? You know, I just didn't know. Well, some of the critical tools that are available for myself and other women to advocate is to go to WomenHeart.org. They provide a wealth of information to empower women.
I've gone through a lot of the training materials from WomenHeart, and I did find it very helpful to learn about angina. I also felt it was good to learn about African Americans and heart disease. So there's a lot of good resources and a lot of good material out there to learn about and to find out about.
Just remember, 80% of heart disease is preventable. You have the power, you have the confidence to engage with your physician, your doctor, your nurse practitioner, and partner on the journey to heart healthy living.